Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. Today's conversation is going to be focused on understanding thyroid health. This is a very prevalent, condition that we see right now in our world, and I see it a lot in clinic. And it's, something that, it's personal to me because many years ago, I also had an issue with a thyroid issue. This conversation is going to focus on, what is the thyroid, what is the function, what are the labs that you should be considering doing, and what are some of the symptoms that you might be experiencing if you have a thyroid hormone imbalance. So I can get really into the medical terms, and I want to be very considerate of my viewers, understanding that some people might not understand the medical terminology, right? The science. So it's my job to teach you what that is. So I will be using both medical and layman terms to help you learn how the thyroid functions. So let's get into it. So what is the thyroid, right? The thyroid gland is located in the base of your neck, the anterior part of the neck, the front part. And it's a butterfly-shaped gland. And this this thyroid gland, produces hormones that help regulate various body functions. And some of those functions are, it controls how we utilize energy. So it's metabolism, heart rate, body temperature, weight, digestion, our mood, blood pressure, brain development, and so much more. So this gland, the way it functions, I'm going to explain to you the two different parts that the body is communicating to make the hormone. So the thyroid gland that's located in your neck is going to be responsible for making two main thyroid hormones. One of them is thyroxine, which is also called T4. And T4 is the main thyroid hormone that's produced in the gland. About 80% of the thyroid hormone is T3, so it's the most abundant in the body. Now, there's two forms of T4 that you should know about that's circulating in your body. There's total T4, and this is bound to a protein, so it stays in the bloodstream. It's what I refer to as your backup supply. Your free T4, this is what's not bound. So this is what's circulating, what's available for the body to use in different tissues and for various functions. So total T4, it's bound to a protein, and it's your storage, supply just in case you run out. And free, anytime you see the word free in the name of a hormone, it's because that's what's circulating. That's what's available for you to use right now. So those are two very important values to look at. The other hormone is triiodithyroxine, also known as T3. And you also have a total T3 and a free T3. And of course, your total is your backup in case you run out. And the free T3 is what's circulating, right? That's not bound to a protein. So the important thing about the hormone T3 is that it is the most active of the two thyroid hormones. So about 20% of what's circulating of thyroid hormone, it's from T3. But this is where this hormone, it's what makes us have energy and makes us feel good. So if this hormone is low, we're not going to feel good. So this hormone is, like I said, it helps with energy production, metabolism function, and brain function. So very important things to consider. Now, the conversion. So the body converts from T4 to T3 hormone. And this conversion is happening in the liver, though the the thyroid is making the hormone. It's in the liver that this T3 hormone becomes activated. About, the majority of the activation happens in the liver. However, there are other organs that there is conversion. It's just in small amounts. The kidneys and muscle tissue is the other areas where you're going to see conversion of T3. So the reason I bring up the where it's converted is because the liver is doing a lot. Not just is it activating T3 into its active form. It's responsible to metabolize, synthesize other hormones, cholesterol and iron, and just there's so many other things that the liver is doing. So liver health is very important to thyroid health as well. I've said it in previous episodes that these hormones and every function in our body, they're not working in isolation. They work with other systems, and one system can impact the way another system is functioning. So very important to understand that. So these things are happening in the thyroid. And because T3, sometimes if we produce too much, some of the symptoms that we would have or signs that our body would give us is feeling agitated, feeling irritated, having heart palpitations. If you're losing weight too quickly, not that anyone would complain about losing weight, but if you're thin and you're losing a lot of weight that you don't want to lose, it could be because you're producing too much T3. So we want to look at the total and free T3 values in a person. So the interesting thing is that the body has this ability to reverse T3 if you're making too much. So I call it the brake pedal. If the body senses that you're making too much T3, it's going to start to inactivate, right? Reverse T3 and puts it in an inactive form. And there is a test. It's not commonly, done, but it's a very important test to check, because sometimes the T3 levels might look like they're normal, but if your body for some reason is reversing too much, it's putting it in an inactive form, you're still going to feel tired even despite you having normal values. So this is, like I said, this is a byproduct of thyroid hormone metabolism, and it puts it in an inactive form to make sure that you're in balance. Otherwise, if you have high levels, like I said, you are going to have irregular heart rate, palpitations. You're going to feel agitated, and if it's seriously high, if T3 is seriously high, it can lead to a heart attack. It's rare that high levels of T3 on its own would cause a heart attack. It would usually be in conjunction with other pre-existing heart conditions. So like I said, unfortunately, this is a test that is not routinely tested for evaluation of the thyroid function. But in my practice and many other naturopathic doctors, what we call functional medicine, or some people call functional medicine, we do check reverse T3. It's an important part of the thyroid panel. Now, we've talked about what the thyroid is doing. But unfortunately, what most doctors are evaluating is only the thyroid stimulating hormone, also known as TSH. So I want to talk about what's going on in the brain and how the brain works in conjunction with the thyroid hormone, with the thyroid gland. So the brain has the ability to sense what's going on in the body. Is the body making enough hormone at the thyroid level? Is it making too much or too little, right? That's what the brain is able to perceive. So the specific places that the brain is doing its job, it's in the hypothalamus. It will release something called thyrotropin releasing hormone, also known as TRH. And this is not commonly checked in blood work. This hormone triggers the pituitary gland to release thyroid stimulating hormone, which in turn will signal the thyroid gland to produce T4 and T3. So the brain is sensing what's going on in the body, and depending on what's going on in the body, that's what the brain is going to tell the thyroid what to do. So I can get very detailed on the process, but I feel like if I do that, I might just lose some of you. And so I want you to pay attention to how I explain it to my patients so that they understand. So the brain is going to perceive, right? It's going to sense and evaluate the body. What is the thyroid doing? If, for example, your thyroid is making too much hormone, the brain is going to lower its volume to let the thyroid know, hey, you're making too much, make less. Now, on the flip side, if your thyroid hormone is, or thyroid gland is making too much hormone, not enough hormones, it's not making enough hormone, the brain is going to increase its volume to let the thyroid gland know you need to make more. You're not making enough. And so the TSH is, I refer to it as the volume. If it's up, if the TSH is high, it's because your thyroid gland is not making enough. If the TSH is too low, it's because you're making too much hormone. And these conditions are called hypothyroidism, so if you're not making enough hormone, and hyperthyroidism, if your body's making too much of the hormone. So there's a whole, negative feedback loop of the thyroid system to the brain and the thyroid gland. They're both communicating with each other and responding. So what happens when the brain is letting the thyroid know, make more, you're not making enough, and it still doesn't make enough? That's our job as doctors, to go in and evaluate the person, assess the person, and try to find what is the root cause of this imbalance, because it's a very complex system. And we're going to talk a little bit about, some of the things that can cause interference with thyroid hormone production. So that's, in essence, that's the bottom line of how it works. So the thyroid gland produces the hormones by using iodine. So iodine is part of the structure of the molecule of T4 and T3. T4 is actually meaning there's 4 iodine molecules in that hormone. And so it cleaves one off and it converts to T3. Now you have only 3 iodine molecules in the T3 form. So there's important minerals that help in the conversion of thyroid hormone, things like selenium, zinc, manganese, not magnesium, manganese, vitamin B3, also known as niacin. And like I said, iodine is really the main contributor to producing thyroid hormone. So some of the different conditions that, we see out there, and I mentioned some of them, it's hyperthyroid, which is you're making too much hormone. Hypothyroidism, which you're producing not enough, right? You're underproducing thyroid hormone. And then there's 2 autoimmune conditions that we commonly see. One of them is Hashimoto's thyroiditis, and this is an autoimmune condition. And it can, where the body can't produce either too much or too little. Usually it's not producing enough. So what's going on with this condition is that your immune system is not recognizing the thyroid as part of itself, of yourself. So it starts to attack the tissue of the thyroid gland, destroying the tissue. And so this affects the thyroid levels. Sometimes it's low, sometimes it's high. But usually, like I said, it's low thyroid hormone production. So someone with a Hashimoto's thyroiditis should be treated differently than someone who just has hypothyroidism. You don't just throw hormone at it. You have to work with the nervous system and the immune system to modulate those two so that it's not attacking the thyroid. Once the immune system stops attacking the thyroid, things will go back to balance. And so we need to, first assess if that is an underlying condition. And we'll talk about which tests to do. The other condition is Graves' disease. So this is also an autoimmune condition that usually what we'll see is higher thyroid levels. And there's some other like subclinical thyroidism and other conditions also that can be impacting the thyroid gland itself. So which are the right tests to do? It boggles my mind that so many conventional doctors, they're just running TSH, that thyroid stimulating hormone. And remember, that's just a signal from the brain. It's not assessing what is the actual gland producing and doing itself. So here's some of the tests that I routinely do for first patients or patients who I suspect they have thyroid issues. Really, I like to do it on all people at least once to see what's going on. And so this is the full panel. You want to do the TSH, which most doctors will do. There's no problem there. But then you have total and free levels of T4. Those are two tests. So your doctor would have to run a total T4 and a free T4 to assess that hormone. Then there's total and free T3. There's reverse T3. The two antibody tests that I check is the thyroglobulin antibody. And this this antibody is a protein that the immune system releases, and that attacks the thyroglobulin cells in the thyroid gland. So if this is elevated, it could be elevated in Hashimoto's, it could be elevated in Graves' disease. It can also be elevated in other autoimmune conditions that are present. And about 25% of individuals that have elevated thyroglobulin antibodies are also found in people who have thyroid carcinoma. So sometimes this could be a test that can help us to detect if there's possibly, a thyroid cancer there. And this test, I usually check annually if there's family history or there's high risk. And if someone does have elevated levels, we check it more frequent, either every 3 months or every 6 months, to see how the treatments are affecting it in a positive way. The other test to do is the thyroid peroxidase antibodies, also known as anti-TPO. This is another protein that's produced by the immune system, and it's in response, and it starts to damage thyroid cells. So it leaks the TPO enzyme, and this is what's able to be detected in blood work. So if this is elevated, it's usually Hashimoto's. And so once again, this is a test that I do annually on all my patients, but if there is a positive or history of Hashimoto's or family history of Hashimoto's or high risk, we'll check it more frequent, 3 months to 6 months. So these are the tests that you want to make sure you get your doctor to run, to check them out. The other thing that, we cannot undermine the importance of a physical exam. And, what I'm finding is that not many doctors are touching and physically examining their patients. And so there is a palpation of the thyroid gland to check if it's enlarged, if there's thyroid nodules there. And so I suggest that, you could do this yourself, palpate the thyroid gland. It's on the bottom part of the thyroid. If you take your fingers and place it there and swallow, you may feel the lump kind of pass through. Usually most people, if the thyroid is not palpable, it's not an issue. But if you feel like it's enlarged or there's swelling or there's any bumps in the area, you definitely want to let your doctor know for them to assess it and do some blood work. Because oftentimes what I find is the blood work is normal and I feel their neck and there's a nodule there. So if there is a nodule or there is a history of autoimmune conditions of the thyroid gland, we want to follow up with imaging. And the follow-up imaging is an ultrasound. You could do an ultrasound with a fine needle biopsy if there is a nodule. And so that's what we would use to assess if what is it cancer, is it autoimmune related. Now there are some additional thyroid cancer screening tests that I do in my office, and other functional doctors, naturopathic doctors do as well. And these tests are usually not covered by insurance, but it's really it can be very valuable, especially if you have a family history of thyroid cancer or you are at risk of having thyroid cancer, especially if there's autoimmune conditions that could put you at risk. These biomarker tests are done by blood work, and it screens for 50 plus markers, and it screens the early stages of cancer. So in stages 1 and 2, when we can get a lot done to reverse it, these biomarker tests can be very, very helpful to do. So what are the symptoms? What are the common symptoms that we see in these thyroid conditions? What's interesting, whether you're hyper or hypo, there's a lot of crossover. And there's some things that distinguish between you making too much and too little. So in someone with Graves' disease, which would be a hyperthyroid state, you're going to see that person's going to experience anxiety. And this is where I tell people, you think you have anxiety, but if there's an underlying medical reason, that could be the cause of the anxiety. And we see this very common in hyperthyroid because remember that the hormone, it makes you have energy. And if it's too high, you have too much energy and it makes you feel agitated and anxious. So you can have a difficulty sleeping, so you'll have insomnia. You can have chronic fatigue. a sensitivity to heat or cold, forgetfulness, so poor concentration, poor memory. With Graves' disease and hyperthyroid, sometimes you'll see people lose weight, but there are some people who do gain weight. So it could be gain weight or weight loss, and it's unexplained weight gain and weight loss. Muscle weakness and tremors. The thyroid can be enlarged. There could be nodules. A common sign that we see in people with Graves' disease is their eyes. Their eyes will, the pressure in their eyes will increase so much that it starts to make the eyes bulge out. So it looks like the eyes are coming out. And this can lead to, complications with their vision later on. Like I said, these individuals will have a lot of heart-related conditions. So these are some of the symptoms of Graves' disease. With Hashimoto's thyroiditis, you're going to see some of that same overlap, but there's even more symptoms that you'll see. Fatigue, you'll have dry, coarse, skin. Skin may appear yellow. You can have brittle hair and nails and hair loss. Menstrual irregularities are present in both conditions. Joint stiffness, an enlarged thyroid, swelling in the neck, so you'll have a goiter. Your face can look puffy, and you won't notice it until the inflammation comes down that you realize just how much puffiness and inflammation your face had. You got thyroid nodules, cognitive decline, depression, difficulty with memory and concentration, voice changes, constipation because you don't have enough thyroid hormone, because remember, it also impacts your digestion, so your digestive system kind of slows down. It does not have the energy to do its job. Fluid retention, you see muscle aches and weaknesses, weight gain, slow heart rate in Hashimoto's, and of course, cold and heat intolerance. So you just can't tolerate extreme heat or extreme cold. So the things that are not so commonly seen in thyroid symptoms or that are acknowledged are infertility. You can't have joint pain and muscle weakness with either of these conditions. With people with Hashimoto's, especially if their levels are really elevated, so they're very uncontrolled state, they can have altered levels of consciousness, like a psychosis. They can experience seizures, ataxia, dementia, tremors, and of course, sleepiness and confusion. So oftentimes people with Hashimoto's think it might be a mental health issue, when in reality, it's your immune system. It's an autoimmune condition, right? So it affects the brain function a lot. And, going back to Graves' disease specifically, if you leave these conditions untreated, it can lead to a thyroidectomy, which means your thyroid gland has to be removed. You're given radioactive iodine therapy. And, because you don't have a thyroid anymore, now you need medication for a lifetime. And so, like I said, some of the complications of Graves' disease I've seen are the bulging eyes, vision loss. They can experience heart issues as well because of the high levels of thyroid hormone. It's a lot. So I'll tell you this, many years ago, in 2006, when I was diagnosed with hypothyroidism, I remember searching the internet and there was very little information. Fast forward in 2024, we have tons of information on thyroid health and function and what causes it. And I remember looking on the internet, trying to understand what causes autoimmune condition. And what I would find is the common statement was, we don't know what causes it. Well, we do have a lot of information now what can cause thyroid issues, specifically autoimmune thyroid conditions. So I'm going to run through a couple things. There's many other things that can have an impact, but what I commonly see is, poor diet. If you have the standard American diet, high inflammatory, foods, that can cause your immune system to malfunction and start to attack the thyroid. If you are constantly in high levels of chronic stress, hey, look, we all experience stress and that's normal. But if you're constantly under chronic stress all the time and you don't know how to regulate that stress, that can really throw your thyroid function off. Sometimes it is genetic, there's a family history, but even then genetics, there's some things on your part that you can do to offset you developing these issues. There are infections, like particular viruses that we have seen, and they're studying that can potentially cause someone to develop autoimmune conditions of the thyroid, such as Epstein-Barr virus, also known as mononucleosis, right? This virus has been known to cause autoimmune conditions and even other cancers in the body. Any trauma, whether the trauma is physical to the neck, to the cervical region, physiological or emotional or psychological or emotional trauma, those are things that can also throw off the thyroid function. And a very important category that we must not ignore is the environmental chemicals that we expose ourselves to, that we're around, products that we use on ourselves. And one of those products that you should know about, and many people do now, is fluoride. So fluoride and iodine are both halogens. Now, if you remember back to the periodic table, you might not care, but they're both halogens. And what that means is that fluoride, it is considered it's more reactive than iodine. And so it's going to compete with iodine. So if you're using fluoride toothpaste or things with fluoride, at the dentist that you'd like to use fluoride, this can compete with iodine, and it will displace iodine from the hormone, and now it's putting fluoride in its place. And so because fluoride has a stronger pull on electrons, it's not, the thyroid hormone is not going to be functioning the same if there's a fluoride there instead of an iodine. And think about mouth health. Anything that we're doing in the mouth, it's going to go into our throat area. It's going to enter our bloodstream. So we need to be very considerate of the chemicals, the environmental chemicals that we're exposing ourselves to. So when I address infection, there are some common viruses that I evaluate for past exposure. I mentioned, Epstein-Barr virus is one of them, and cytomegalovirus, or CMV, is it's short term. We assess that, and then I've also seen people who have had COVID or the vaccine, have issues with developing autoimmune conditions, specifically autoimmune conditions, where I've seen that be a problem. So we always want to address inflammation. We want to make sure that with autoimmune conditions, we want to address inflammation. We want to address the modulating the immune system and the nervous system, also the digestive system as it relates to autoimmune conditions. So like I mentioned earlier, autoimmune conditions, this is the body's immune system starts to attack itself. And that is not normal. It should attack a pathogen, right? A virus or bacteria that we may be exposed to, but it should not start to attack a gland or a organ that's in our bodies. And so this happens usually because something triggered the immune system to lose its mind. So some of the things that I've understood, like I said, it could be viruses, but sometimes it's trauma. And I've talked to some immunologists that work specifically with trauma and autoimmune conditions, and the trifecta that we see noted when these things start to create autoimmune diseases is there's usually a stressor, so some kind of a trauma. And remember, stress can be a physical trauma too. It creates a stress response in the body. There's high levels of inflammation. And then you get a viral infection, and that viral infection seems to be, the straw that broke the camel's back, and then people tend to be compromised, and they're not able to regulate, so go back to balance, and they end up developing an autoimmune condition. I want to talk about some mistakes that I see medical doctors do when it comes to screening the thyroid. I mentioned it earlier. It's not completely their fault. Oftentimes, they're basing their decision on standard guidelines, medical guidelines, and also what your insurance covers. So one thing that, is that they just don't test enough. They don't test enough of the other functions of the thyroid hormone. They're only checking TSH, and TSH is only, released from the brain. So it's not looking at what the actual gland is doing itself. And so we need to look at T3 and T4 levels. We need to look at if there's autoimmune conditions that's impacting it. And see, typically the reason they don't check these thyroid hormones, the additional ones besides TSH, is because their approach doesn't change. They're still going to throw medication at it. They're not going to talk about diet. They're not going to talk about lifestyle changes. They're not going to say, hey, let's do this for modulating your immune system, reducing inflammation, reducing stress. They're still going to give you levothyroxine, which is the common T4 medication that's given. Whether you have Hashimoto's or not, that's what you're going to get. And they're going to check every 3 to 6 months, and that's the only thing they're checking. Now, I'll tell you, I have had patients that I do the full panel. TSH is normal. It's actually in optimal levels. But when I look at T4, T3, reverse T3, and the antibodies, those could be off. And now it's telling me a story. It's saying there's something off. It's just not showing up in the TSH yet. So what we have is an opportunity to start addressing this imbalance and start giving the body what it needs, right, to bring it back to homeostasis, to bring it back to balance. And the only way to do that is to do the full panel. Now, if someone comes in for the first time and I do the full panel and the antibody tests are negative, so it's not present, I'm not going to check it again. I might check it in the next year or two just to make sure it stays negative, but that's not something that I would assess more regularly. It would be the other hormones that we talked about. So yeah, the other thing that I see that doctors, drop the ball is not performing those physical exams, not palpating the thyroid. That gives us information so that we know, okay, let's send them and let's do an ultrasound. So I've had a few patients in my practice where all of the thyroid tests were normal. The TSH, the total T3, T4, reverse T3, no antibodies were present. But on palpation and doing the physical exam, I felt a nodule. And so I send them to do an ultrasound. And then the ultrasound reveals there's thyroid carcinoma. So we caught something that was not on blood work. It was done on a physical exam. I cannot emphasize, if you're a doctor watching this, if you are a nurse, whatever it is, whoever, if you have the ability to palpate someone's thyroid, do it, because it's very common for people to have enlarged thyroid glands or have nodules on them, and patients don't even know because they didn't go to medical school to know to do that. But if you're watching this, you can palpate your own thyroid and assess it so that if you do feel it, then you can let your doctor know and they can do a full workup. Once again, I did an episode in the past on advocating for yourself. And this is one of those things. Examine yourself and advocate for yourself and ask for these tests. If you have a good understanding of how the thyroid function and you explain this to your doctor, they're going to listen to you, most likely be willing to do these tests. And if not, then find a doctor who is willing, because like I said, the approach to whatever condition is related to thyroid, it's going to be medication or surgery. And I want you to know that there are other solutions to helping your thyroid improve and function better. So those are some of the things that I want to leave you with. So where do you want to start? Talk to your doctor about the labs we mentioned earlier that you want to run the full panel and take it to them, write it down and say, these are the tests that I want to, do and why you want to do them, especially if there's family history or you think you may have it. And if they don't want to run those tests, like, I am serious, find another doctor. In 2006, when I was assessed, they told me I had hypothyroid. Years later down the road, I still didn't feel well, even with the medication. So I continued to find a doctor that was willing to do a further workup. And I didn't know at the time all the tests that I could have done. And then I came across the right doctor who said, we're going to do all these tests. And that's where they found that I actually had something called Hashimoto's and not hypothyroidism. Yeah, the Hashimoto's was causing hypothyroidism, but the root cause was this autoimmune response. So then we started to work through that. I had made a lot of dietary changes, but we added some other things to my regimen, and that really helped. And I'll tell you, as a personal testimony, that you can reverse Hashimoto's. You can put it into remission. However, we need to be logical and think things through, that this is going to mean there's a lifestyle change here. And I'll tell you, the number one thing that will trigger antibodies to come up just a little bit is stress. For me, it's not the diet. It's not anything else. I've removed a lot of environmental chemicals out of my life. but it is stress. So I understand how important it is to find a way to relieve your stress, because if you don't, it will throw the thyroid function off. It just will. It is very draining to have high levels of stress. So I always suggest having 2, 3, 4, 5 different things that you can turn to relieve stress, whether it's some herbal supplements that help with stress management. My favorite one is, Daily Stress Formula by Pure Encapsulations. It just has a wonderful combination there to help, modulate the nervous system, so you're not having such a high stress response. Sleep, exercise, prayer, meditation, having a good conversation with a friend can also help with stress levels. So, hey, I hope that you guys have, really taken a lot of educational information from this. I'm not telling you these things to treat you. It's really for educational purposes. If you have any questions and you want to reach out on how I can possibly, help you and work with you, you can visit my website for a free and schedule a free 15-minute phone consultation on how, we can help you out. So now I want to turn it over to talking about the good, the bad, and the ugly of the sick care medical system. So doctors not performing a physical exam and palpation of the thyroid gland is something that's really bad. And I mentioned it earlier in the podcast. I am really big on palpating people's thyroid. And sometimes it's visible. You can sometimes see that it's enlarged or there's a nodule. So if your doctor's not doing them, tell them, can you please check my thyroid, make sure it's normal, especially if you do have, hypothyroidism or hyperthyroidism. You want to make sure you're getting a full, thorough evaluation. I hope you've enjoyed this conversation on thyroid health. And until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raíces, visit our website at raicesndmedcenter.com. Until next time, be blessed.